In this video, we're going to talk about how to use a long spine board and a scoop stretcher, both of which are featured here. We'll start with the long spine board. In some agencies, this is known as a long board, a spine board, or a back board. Regardless, if you have a straight, flat, hard board, you're working with the same device. The purpose of this is several. First, it can be for spinal immobilization if your agency does so. In other words, the patient will be lying flat or supine on the backboard with a headbed keeping their head and cervical spine immobilized, and all of their extremities and total body will be restrained and secured to the board, preventing any movement. The second use for this spine board or backboard, if you're not going to immobilize, is extrication. We will demonstrate how to extricate a patient using this board, where it essentially serves as a frictionless surface so that a patient can be slid across it, let's say out of a vehicle that might be crushed where the patient is entrapped. Otherwise, it is not recommended that you keep a patient on a long spine board for an extended period of time, as the hard surface can cause injury to the patient's skin and worsen the current injuries that they have. Note that in your agency, a spine board, long backboard, may have straps pre-attached to it. If it does not, as in this case, these holes provide areas for certain clip straps or belt straps, and then also for gripping for hands for lifting a patient or extricating a patient. This is a scoop stretcher. This doesn't serve the exact same purpose as the long spine board, however, it is useful for moving patients. The unique characteristic about this scoop stretcher is that it splits in half on both ends, allowing you to scoop up a patient who otherwise cannot stand or be moved. Like the long spine board, it has areas to grip on both sides. Note that it has an area of a void in the middle, so you want to be careful not to get anything caught in the middle while moving a patient or while scooping anything up. The scoop stretcher is also adjustable. So you want to position this next to the patient, adjust for their height and leg length prior to putting them on the scoop stretcher to ensure that they fit. You also can attach seat belts and other straps device to keep the patient in place on the scoop stretcher.